Hi everybody, I'm Dr. Ty Vincent. It's the middle of the COVID-19 chaos, and there's a lot of information out there on the internet, some good, some bad, some that doesn't make any sense. I'm sure you've been exposed to all of it. I've been trying to put videos out now and then discussing certain topics that have gained some popularity or traction, and whether I think they do make sense or not, okay, for what it's worth. I am a medical doctor. I do have experience managing intensive care unit patients, ventilators, but not for quite a number of years. My area of expertise is in immunological disorders, but I've also had a very wide, broad career in integrative medicine and managing all kinds of complicated health issues. So a recent video, it's now the middle of April, a recent video that's been circulating that people have asked me about a number of times is about a drug called Diamox, or the generic is Acetazolamide, and whether or not it may offer some assistance or benefit in the Covid-19 illness. So like, especially when it manifests as acute respiratory distress syndrome. So nobody's suggesting that this drug might be an antiviral or do anything directly against the virus, but maybe it would mitigate the symptoms that involve the lungs and the inflammatory response there. Because there was a doctor from New York who put out a video talking about how the respiratory illness they were seeing in these COVID-19 patients was somewhat analogous to mountain sickness or high altitude sickness. And so then one woman who did some more research on that put a particular video on the internet. Maybe there's more than one person who's followed this particular line of thought, but one in particular did, and discovered, that there are drugs to treat altitude sickness. And one of them is acetazolamide, which is, as she mentioned accurately, a carbonic anhydrase inhibitor, which doesn't make sense to most people, but it basically relates to acid-base balance, the production of bicarbonate, how that helps assist with fluid in tissues, blood pressure. It's actually used as a blood pressure drug to some extent, and also the cardiovascular dynamics that are involved with gas exchange, so oxygen and carbon dioxide exchange. It's complicated, but because of the low oxygen pressure at high altitude, people end up with some of those metabolic disturbances that involve oxygen and carbon dioxide and bicarbonate, carbonic acid, enzyme transfers and things like that. So that's how you get from the COVID-19 thing to a blood pressure drug that's used for mountain sickness. So the premise is there. And she found this article to reference, which is always good when somebody does their research. Kudos to somebody who doesn't just blurt out, oh my God, quinine kills the virus and it's in tonic water, you better go get a whole gallon of it and drink it because somebody said something that doesn't make any sense and they traced it to quinine. I've already talked about that. So acetazolamide, in this little article, this is an article she found where there's a discussion of whether or not acetazolamide and a couple of other drugs, nifedipine and phosphodiesterase inhibitors. Just so you know, one classic example of a phosphodiesterase inhibitor, PDE-I, that we call them, is Viagra. Okay, Viagra is a phosphodiesterase inhibitor. Nifedipine is a calcium channel blocker. What those drugs do is they dilate arteries. They cause vasodilation. And they can dilate blood vessels in the lungs, which will assist with blood perfusion or blood passage through the lung beds. But they don't improve oxygenation of the blood, okay? And in fact, if you have a difficulty with oxygen transport from the air into your bloodstream, using a vasodilator that might speed the movement of blood through there can make it worse because the blood doesn't go through slow enough to pick up oxygen through tissue that's edematous and not diffusing properly. So one thing I want to point out about this article that this woman found is that it's not a study. It's actually not a scientific experiment study at all. It's speculative. It's complete speculation as to whether or not these three drugs might have any impact for the same reasons that she encountered it. Like, oh, these are sometimes used for mountain sickness associated things, so maybe we should think about whether or not they work. So it's not an actual study. It doesn't confirm or deny the theory at all, that study that was shown. So what I did was I looked for evidence about acetazolamide and the actual physiological effects it has on people with mountain sickness. And one thing you have to realize is that the initial symptoms of acute mountain sickness are mostly in the brain. So you get cardiovascular effects, vasodilation effects in the brain that can lead to headaches and dizziness and confusion for people, disorientation. And so acetazolamide significantly helps prevent those symptoms from occurring because of these cardiovascular effects it tends to have. But it's not necessarily thought to have any effects in the lungs. So the secondary complications of altitude sickness, if you stay there, so like if you get those early symptoms that involve the brain and you get down the mountain quickly enough, you probably won't end up with pulmonary edema, which is the dreaded complication. Okay, that's a secondary occurrence if you endure this low oxygen state for too long. And it's characterized by pulmonary edema, kind of like respiratory distress syndrome, which is where the other doctor's analogy came in. There's inflammation within the lung that you can see due to the capillary dilation and some of the leaking and potential tissue disruption that occurs from that. And then there's a significant impairment in oxygen transfer from the air to the bloodstream, because it's like I mentioned in another video about this virus and ARDS, it's like trying to breathe through a pillow. Instead of just a cotton mask, try putting a pillow over your face and see if you can breathe. That's what's going on in the lung, is that tissue expansion, and oxygen can't get through. You can measure oxygen transfer from the air into the bloodstream. It's something called diffusion capacity, or they call it DLCO. And then you can measure some of these inflammatory markers in the blood that are indicative of, blood vessel dilation, the inflammatory cascade going on in the lung tissue. So here's a study that did look at acetazolamide and whether or not it had any impact on those features in the lung. So they measured DLCO. If you care to look at it, you can look up the study yourself. They actually looked at diffusion capacity. They looked at the inflammatory parameters. They did this in Italy. They had some people in Milan. They had some people up at some resort that was at altitude for a few days, and then they tracked these things. And they compared it to placebo. Okay, so this is an actual study. So the woman in the other video posed the question. This is a scientific attempt at answering that question, and there was no difference. Bottom line, acetazolamide did not have any effect on the lung issue that's seen in altitude sickness. It definitely reduces the cerebrovascular complications. That's why it's used in altitude sickness. But this study kind of definitively shows that there was no difference between those patients who were given acetazolamide and those who were given placebo. There were like 22 people in the study. It's not a big study. It's not easy to get that many people to agree to something like this. But they looked at very relevant scientific parameters, the things you would actually measure that are relevant in ARDS, that are relevant in ventilator-dependent patients. And acetazolamide, unfortunately, had no effect. So, as near as I can tell, there's your answer for those of you who were wanting to know more about this particular potential intervention. Doesn't look like it's going to work.